Good afternoon, everyone. This is Tiffany Simpson-Crumpley. I will be your presenter for today for the fifth installment of the Best Chance Network and Wise Woman World Training Series. Today's focus will be on basic education about what is Wise Woman and giving you an overview about this program. Our hopes for today is that by the end of this webinar, participants will learn basic information about the Wise Woman program, including eligibility requirements, program services, building blocks for a successful program, financial benefits for providers, as well as next steps if you are interested in offering this service in your practice. I'd like to thank those of you that are sharing your lunchtime with me today. If you are here, that lets me know that you are committed to providing the best quality of services to vulnerable women that you are already serving in your practice. And so our hopes today is that we provide you with some useful information to increase the wraparound or comprehensive health services that you provide already. We're going to go through this presentation today, and please type your questions into the chat box, and then there's a designated time for Q&A, and either myself, Linda Peccary, who is the program manager who has tuned in today, will answer specific questions about offering Wise Woman services. So with that said, we're going to go ahead and get started. So just to connect a face with the name, I'm Tiffany Simpson-Crumpley. I served as the education and training consultant for this wonderful partnership that we have with DHEC's Wise Woman and Best Chance Network programs. I have served in public health agencies for over 20 years, and I began my career as a medical admitting clerk and community health worker in urban communities in California, and then transitioned to the Southeast to work on systems of care access points for uninsured and underinsured adults in North and South Carolina, and it is my pleasure to serve you today. So just a quick review. As I have mentioned, this is now the fifth installment of this webinar series. So we began with the foundation for these services with the nuts and bolts of implementing an effective Best Chance Network program. So this was a webinar where we talked about basic eligibility requirements, the types of services that Best Chance Network offers, and then we moved into what does that look like on a day-to-day basis. And for many of you, you are in lockstep with your electronic health record system. So in that training, we talked about how to maximize activating patient screening reminder campaigns. Had a wonderful lady from Singleton Rural Health Center walk folks through what that looks like in an actual EHR process, but also the importance of using that and telephonic reminders via text messaging and activating that through your EHR to proactively bring patients in for these services that you may be providing already. Then we moved into billing for success. So this is where the dollars and cents came into play. So if you are a BCN or Wise Woman provider or thinking about it, we had two wonderful ladies, experts who process billing forms every day for both of these programs, who offered their time and expertise so that you avoid common mistakes in terms of the filling out of forms and the importance of making sure you capture critical pieces of information so you can be paid for those services. Then last week's webinar talked about the front desk, the gateway for effective patient engagement. This is where we talked about the human interaction experience, how the front desk sets the tone for the rest of that woman's visit, and the importance of employing basic customer service principles so that woman will return back not only for her first screening appointment, but that she makes your home her medical home, and she receives comprehensive care and the best services. So we talked about that, but not just the front desk, but really understanding the culture around how we relate to self-pay patients and uninsured patients, and treating them the same as someone who has employer-sponsored health insurance, so they feel respected and that they're receiving dignified care when they come to your facility. So if you are interested in tuning in for those webinars, please let me know, and I can provide you with the replay links for that as well. So with that said, we're going to go ahead and launch into today's topic, which is, what is Wise Woman? So really quickly, the reason why I'm offering Best Chance Network information here is that BCN and Wise Woman, you might as well consider them the dynamic duo of providing comprehensive screening and preventive services to an uninsured or underinsured woman. So as you all may be aware, the Best Chance Network provides free comprehensive breast examinations, pap smears, HPV testing, and mammograms. And commonly in the community where it's known about, the community refers to it as the free mammogram program. And so that's just a listing of services that are provided, but coupled with that, you have the Wise Woman program. So the foundation of eligibility for Wise Woman is the Best Chance Network. So you have to be a BCN provider, and that woman has to be 40 to 64 years of age. So that is the only difference between Best Chance Network and Wise Woman, is that Wise Woman, the starting age is 40. However, you may have women that are co-eligible for these programs. And so the common threads for both programs are a woman who lives in South Carolina, does not have health insurance, or is underinsured. So for whatever reason, they don't cover comprehensive health screenings. It only covers hospital care. For women that have received health insurance policies through the Federal Insurance Exchange, or what we commonly refer to as Obamacare, if they have a deductible of $1,000 or higher, they also qualify for services. So what is Wise Woman? So Wise Woman is an acronym for Well-Integrated Screening and Evaluation for Women Across the Nation. Since 2008, DHEC has offered Wise Woman services to provide health screenings and lifestyle education for women 40 to 64 years of age to reduce their overall risk for heart disease, stroke, and diabetes. As I have mentioned before, BCN and Wise Woman in an ideal clinic setting would be offered as a dynamic duo where you're providing comprehensive screening services. If you have a self-pay woman who walks into your office that meets the income eligibility requirements, you have the opportunity to provide billable and reimbursable services to this woman to prevent high blood pressure, obesity, and ultimately the development of cancer. So there have been clinical linkages between uncontrolled high blood pressure and the risk for developing cancer later on in life. Women who go through the Wise Woman program receive screenings at no cost, as I have mentioned before. Screenings include blood pressure and cholesterol screenings, HbA1c testing for diabetes, screening and prevention, body weight in the form of BMI, and measurements of waist and hip circumference. So really providing a good array of screening so that woman knows her risk for developing high blood pressure and other chronic diseases. If something is identified on lab tests, abnormal levels, or any of those tests, a medical referral and follow-up services are provided as needed. There's also a health coaching component, which we won't go in depth today because we're going to devote the next two webinars to really getting into the other moving pieces of Wise Woman. But in addition to those screenings, it doesn't stop there. A woman is coached by a designated staff person in your practice or health center to reduce her risk for heart attack, addressing nutritional issues at home, and encouraging her to increase her physical activity and stop smoking. So this is really one-to-one communication and coaching so she can manage and take care of herself when she leaves the four walls of your clinic. Again, as I've mentioned before, the foundation for eligibility for Wise Woman is that you must be a BCN provider already. Again, a South Carolina resident. And again, the only difference between Wise Woman and BCN is that BCN program eligibility starts at 40 years of age. And then the other next two criteria are the same as Best Chance Network. So this is just a sample as of June 29th of this year eligibility requirements. And so that gives you a sense of the household size and where that qualifying income would be for a woman to come into a Best Chance Network and or Wise Woman program. So I'm sharing with you today heart disease mortality rates for a 4-year period by DHEC regions, and this is all races factored involved. So I was intentional about sharing heart disease because what we know is that uncontrolled high blood pressure, uncontrolled diabetes, can lead to heart disease. And so this is what the disease burden looks like across our state. And I'd like to bring special attention to the red and orange areas. So if you are a provider in any of these counties or you have sites in any of these counties, you should be not only a BCN provider, but a Wise Woman provider as well. So we're looking at that upper PD, lower PD region, Chester County, Cherokee County, parts of Edgefield, and then we look at the gateway to the low country. So looking at Calhoun County and south, we're looking at Barnwell, Bamberg, Allendale. So again, if you are a provider or you have sites in these areas, the best case scenario is to be offering these services so a woman does not die from heart disease. So let's talk about statistics. So for heart disease is the second leading cause of death for all women in South Carolina and is the leading killer for African American women in the Palmetto State. Over 4,000 women have died from heart disease in South Carolina as of 2013. Over 23,000 women have been hospitalized for heart disease, and a total of $1.24 billion was spent on hospitalizations related to heart disease. So keep that $1.2 billion figure in your mind. The ultimate goals of Wise Woman are to provide low-income and uninsured women 40 to 64 years of age with knowledge, skills, and opportunities to improve their diet, participate in physical activity in the home or in their community, and addressing lifestyle behaviors to prevent or delay cardiovascular and other chronic diseases. Funding from the Wise Woman program comes from the Centers for Disease Control, and Wise Woman in South Carolina is one of only 21 Wise Woman programs funded by the CDC. So I spoke of keeping that $1.24 billion figure in your mind. So ideally, this is a scenario of a 40-year-old woman, assuming that she meets all of the eligibility requirements, that has the capacity to be offered Best Chance Network services and Wise Woman services. So if we look at BCN, if she receives that array of services, you would be reimbursed at $254.86. Add Wise Woman to that. That woman receives assessment, counseling, and labs. And if abnormal levels are identified, the potential to come back for a revisit. And total between BCN as well as Wise Woman Services, you are looking at over $400 for one self-pay patient. So really looking at the capacity to bring a woman in, provide those services, and be reimbursed, and avoid that 1.2 billion and increasing costs spent across the state by providing these services. And it's a win-win. So really the take home here is to really rethink our perspective of the self-pay patient, that in some cases, if they're offered these services, you are reimbursed really at a better rate than current Medicaid reimbursement rates for similar services. So you're sitting there and you're eating your lunch and you're saying, okay, this is great, BCN and Wise Woman, is this a fit? But how does this benefit my practice? So we're answering the WIIMF question, what's in it for me? Definitely increased revenue by providing both services. In some cases, you're already serving these patients through programs like the Healthy Outcomes Plan or Access Health. Some of you that are tuning in today are providers for one or both of those programs. You can be reimbursed for these services as well. For Wise Woman, it's not just the screening. They provide diabetes prevention education and lifestyle coaching, and opportunities to engage in physical activity in their communities. And when you think about it, those of us that have private insurance may not even receive those services for free, or have to schedule multiple appointments to get that same service. Ideally, in a Wise Woman program, she can receive all of those services under one roof, and in some cases in maybe 1 to 3 appointments. So that's another benefit. For those of you that are engaging in quality improvement activities in your practice, if you set the foundation for BCN and Wise Woman, you're providing those screenings through those programs and documenting them in your EHR, it aligns very well with receiving patient-centered medical home accreditation, better performance on HEDIS measures, as well as the Physician Quality Reporting System, PQRS. Going a layer deeper to provide concrete examples of alignment with BCN and Wise Woman is just example of how providing those services aligns with the standards that you would need to become a patient-centered medical home. For meaningful use, these are examples of quality improvement measures that also qualify you for meaningful use incentives and payment for your practice from CMS. So controlling high blood pressure, HbA1c testing, and comprehensive diabetes care in line with blood pressure control. So again, multiple benefits and the opportunity not only to be reimbursed from that physical encounter, but also future payment and future competitiveness for better reimbursement for these other quality improvement methodologies. So here again, for HEDIS measures, your patient satisfaction survey, if your patients are receiving good care in your facility, that's going to reflect in your patient satisfaction surveys. Also, high blood pressure screening, blood glucose screening, making sure you're performing well on that. Again, you can renegotiate your contracts with payers based on better performance in these areas. And the same goes for MACRA and MIPS as well. So in this brief webinar today and just giving you a taste of what Wise Woman is all about, here are the takeaways. So again, if you are not a BCN provider, that is the first requirement for participating in the Wise Woman program. I strongly would like you to consider becoming a Best Chance Network provider, and that's the first step. and then adding Wise Woman, so you're providing that comprehensive care to self-pay and underinsured patients in your practice. So, and for those of you that are already offering BCN services, the latest information from DHEC's Program Director for Best Chance Network, who is tuned in today, is that you're due to renew your 5-year contract. So guess what? You can add Wise Woman to that contract without having to go through a separate contracting process with DHEC. So again, on their end, they're trying to make it easy for you to be able to provide both services and fast track you if you are already a BCN provider. A critical thing for BCN and Wise Woman, this is something that we've learned from folks that are already implementing this service. You have to designate a member of your staff to be a practice champion, and usually that person would be ideal to be a health coach. You're saying, Tiffany, what is a health coach? Well, guess what? When a patient comes in and you're asking what type of foods they're eating, how their blood pressure has been, what's happening in the home, really talking to the woman and encouraging her to take care of herself, you are naturally, through conversation, providing health coaching services. But guess what? We're just not calling it that. So to formalize what you already do in your practice, SCORE, in partnership with DHEC's BCN and Wise Woman programs, will be offering a live health coaching boot camp on Monday, June 26th from 9 a.m. to 3 p.m. So this is intended for existing Wise Woman coaches who need a refresher and would like on-site training, and then also folks who are thinking about offering BCN and Wise Woman services. So you would need to contact Linda Peccary at DHEC and let her know that you're interested, and then we would register you for that boot camp. So we are in the process of setting up formal registration, but I will give you information at the end for a contact. So if you just want your name on a list before we get our site up, we can factor you into that as well. It is now time for the question and answer session. If you have questions, you have the opportunity to either raise your hand or you can type questions into the chat box and I will respond to you promptly. Linda, if you have to add to what's been presented today, please feel free.
All right.
Okay, our first live question is from Debbie Slasik. And she is a director with the Access Health Program in Beaufort, serving the Beaufort area. Debbie, how are you? Debbie, are you there? Debbie, I've unmuted you, so if you'd like to speak your question, that's fine. Let's see. So this question is coming from Kia West. If a patient already has a diagnosis of diabetes mellitus and hypertension and high cholesterol, do they still qualify for Wise Woman services? Linda, I'm going to turn that question over to you.
Yes, she definitely can. It's an annual screening program, so even though a woman has known diabetes or known heart disease or hypertension, we definitely want her to participate in the program. So women, again, must be enrolled in the Best Chance Network program in order to get Wise Woman. So if that's the starting point, let's get her into the Best Chance Network, and then where Wise Woman's available and co-located at those clinics, yes, we definitely want that woman to get her screening. And she can still have opportunities to meet with the health coaches to help her continue to improve her lifestyle, healthy eating, active living. So yes, definitely. It does not exclude anybody if they already have known diabetes or known heart disease.
Okay. Next question is coming from Cindy New. She is an Access Health Program Director serving the Lakelands area. Her question is, can a free clinic be a BCN and Wise Woman provider?
From what I understand, some clinics have certain malpractice insurance stipulations that would prohibit them from getting any reimbursements, but they can provide the programs and they just can't bill DHEC for the services. Other free clinics, from what I understand, can receive reimbursements from DHEC. So it just depends on your malpractice insurance. So that would be, worth a look at what the conditions of that insurance that you provide as a free clinic are.
Thanks so much for that response. And actually, Linda, we do have free clinics or providers. I believe the Community Free Clinic of Kershaw is a provider. So again, it just depends on how your clinic is configured. Correct, Linda?
That's correct.
Okay. And then let's see, will the boot camps be nearby DHECs? Will we train at the Florence, South Carolina DHEC? Actually, this question is from Jennifer Robinson. Thank you for sharing that question. At the boot camp will be in the central part of the state, so more than likely we are nailing down venues as we speak, but it will probably be in Lexington or Columbia, South Carolina. And we will, so one thing that we will be doing is I send out updates and let you know about when upcoming webinars are. So when I send that out to this group, I will send out, and we should have a location identified within the next week or so. But we want you to definitely save the date if you are interested. Again, this is another health coaching boot camp question. Can you share more details about the health coaching boot camp? Yes, Tiffany from Federal Healthcare. There's quite a few of you on here. Thanks so much for engaging with us today. The health coaching boot camp is really giving you the first taste of what you're doing already. So we have Dr. Cheryl Dye, who's the state's leading expert around training peer-based health coaches, so training lay people in the community how to become health coaches. But those same skills would definitely apply to staff that are already serving in Wise Woman programs across the state, or staff that are thinking about becoming health coaches. So health coaches could easily be a community health worker. It can easily be a medical assistant. So she'll provide basic education about what health coaching is and really highlight what you're doing already and do some fun and engaging activities like the patient provider conversation, or what that conversation would look like. And then in the second half of that day, we will be featuring actual Wise Woman program providers that will talk about what health coaches do. And then at the end of that health coaching boot camp, you have the opportunity to sign up to become a Wise Woman provider. Linda Peccary will be in attendance and will provide an overview of Wise Woman program services. But we're going to go a step further by engaging people that are already providing services, so you know what the key components are to a successful program. So I hope I answered your question, Tiffany. If I didn't, please send me an email. This question comes from Debbie Slasik. She is an Access Health Program Director serving the Beaufort area. Our hospital is already a BCN provider. Do we need a separate contract to be BCN and Wise Woman, or can we provide this under the hospital's contract? So Linda, the information that I received from Trinesha Jones is that if you're already a BCN provider, you can just add that to your 5-year contract.
Yes, it's actually it's not a separate track necessarily, but it's in addition to the Best Chance Network. But yes, that would have to take place by contact me at DHEC, and we can get the WISEWOMAN piece of that contract in place.
Okay, wonderful. Next question. This question also comes from Kia West. If a patient comes in and has labs drawn before their BCN and WISEWOMAN visits, will you back pay for those services?
Yes, you can use the lab reports within 30 days prior to the WISEWOMAN screening visit. You could draw labs the same day of the screening visit or within 30 days after the visit.
So great information. Thanks so much for answering that question, Linda. Right now, last call for questions. If not, this is definitely not your last opportunity to present questions. At the end of these slides, I will provide you with contact information where you can present your questions to Linda via email or phone call. Oh, we do have another question. Okay, I guess we don't. So this is a schedule of upcoming Best Chance Network and WISEWOMAN webinar trainings. Again, there will always be from the 12 to 1 o'clock time during the lunch hour. They roughly span from about 30 minutes to an hour. And so these are the upcoming trainings. Next week, we're going to delve deeper into WISEWOMAN and really why rural practices need to be providers. So takeaways from this one: if you serve in the Marlboro, Marion County, the upper PD or lower PD areas, and you are not a provider, we want to talk about why it's important that we have as many access points for these services as possible in rural communities. So we'll be providing hardcore data, the impact of poverty on vulnerable women and how that is related to these services, and program leaders will share their expertise. So we will have a guest presenter who is actually providing these services and giving you strategy around how to offer these services without creating extra work. One of the things that we've learned in interviewing programs across the state is that having enough staff to offer these services is an issue, but also really not creating additional paperwork. So really giving you strategy around how to streamline and integrate BCN and WISEWOMAN services into your program. June 1st, we'll be talking about the other components of WISEWOMAN. So we really primarily focused on the screening aspects of the program, but this program offers, through health coaching, the diabetes prevention program for women who have been identified as diabetic, how to prevent that. If they're struggling with being overweight, there's also a formalized program to help them with weight management. So these are added benefits. So we will delve deeper into those other program components. June 8th, we'll be talking about billing for success. We'll be bringing back DHEC experts to provide step-by-step instructions for completing billing programs. I believe Genevieve may have tuned in today. She did an excellent job on the last webinar and really provides you with practical tips to avoid the delay in you being reimbursed for WISEWOMAN services. June 26th, that will be our live health coaching boot camp. And so I provided a basic description of that, but that, again, if you're an existing BCN WISEWOMAN program provider and you'd like just a refresher in terms of health coaching and what that looks like on a day-to-day basis, we encourage you to come. And then we would like the newbies, folks that want to offer the WISEWOMAN service and have the opportunity to formally become a health coach, and Linda will be in attendance there, as well as other folks to receive that great on-site practical training. As always, we are here to help, not just online, but in person. If you are going through the patient-centered medical home process, these programs are a wonderful complement to that process and the standards that you have to meet to receive accreditation. For those of you that are ramping up for MAC or better reimbursement from CMS, we have staff that can come into your practice and help you with that, as well as rural health clinic designation. And so that's simply being certified by CMS as a rural health clinic, and what that looks like so you can receive better reimbursement across the board for services offered in your community. Key contacts. So Trinessa Jones is the Best Chance Network Director. If you're not offering BCN services, this will be your first line of action if you want to provide Wise Woman, because you must be providing BCN services to become a Wise Woman provider. For those of you that are offering BCN and you're on the fence about offering Wise Woman services, Linda is your point of contact, and her information is provided as well. I am Tiffany Simpson-Crumpley, and I'm your education and training consultant and will be the navigator for these webinars in the future. So, particularly for the boot camp, I forgot to include Andrew Chandler's information. He is the program coordinator behind the scenes that helps with these trainings. His email address is chandler@scorh.net. So that's chandler@score.net. So as soon as we have a venue identified, if you want to be on a list and you have staff that you know already wants to come, please send your information to Andrew and go from there for the live boot camp. For those of you that may not be BCN providers or Wise Woman providers, and you need on-site assistance, or you're thinking about it, we have a staff person who can come into your practice and analyze your workflow and give you some strategies around integrating these programs so you can be successful in offering BCN and Wise Woman services. So that is LaShonda Petaway Brown. And so with that said, I am going to bring this webinar to a close. I'd like to ask you to complete the brief 4-question survey about how you liked the webinar today or how we can improve, and anything else that you may need assistance with. Use that evaluation to give us communication, and we look forward to seeing you next week for our 6th installment of the BCN Wise Woman Rural Outreach Training Series. Thank you, and I look forward to you joining me next week. Let's see, I think we have one more question. Okay, so repeat Andrew's information, Chandler@scorh.net. So that's CHANDLER@score.net. And there's an extra treat that I completely forgot about for you. For those of you that stayed to the end, there is a Best Chance Network and Wise Woman Leave Behind document. So think of this as your cheat sheet to activate these programs in your practices. There are 10 tips for success based on our interviews with providers across the state. And so that is your gift from us for contributing your time today. So that document is available for you. If you click on the handouts arrow, you'll see that handout there. And please feel free to customize that. But this is our kind of cheat sheet to help you out on a day-to-day basis for those of you that are offering program services already. So thanks so much, and I'll see you next week.